Masinde Muliro University of Science and Technology. The university prides in offering outstanding programs that no other university offers in the country. One of the programs offered is Optometry and Vision Science, hosted in the School of Public Health and Biomedical Sciences.
My name is Professor Edwin Kadima Wamukoyan. I'm the Dean of the School of Public Health, Biomedical Science and Technology at Masinde Muliro University of Science and Technology. The School of Public Health, Biomedical Science and Technology has 6 departments, namely the Department of Public Health, the Department of Health Professionals Education, the Department of Medical Laboratory Sciences, the Department of Health Promotion and Sports Science, the Department of Nutrition, and the Department of Optometry and Vision Science. The Department of Optometry and Vision Science was established in 2010. During this time, the program on offer was a 4-year program, the Bachelor of Science in Optometry and Vision Science. From this program, the first 7 students who finished the program graduated in 2014. The second group of 43 students graduated in 2015, and the third group of students of 40 students graduated in 2016. The fourth cohort of students in optometry were 24, and they graduated in 2017. The fifth cohort of 23 graduated in 2018. At this time now, there was a revision of the program. The program BSc Optometry curriculum was reviewed in 2015 from a 4-year program to a 5-year program. It was called the Bachelor of Optometry and Vision Science. The difference between the earlier program and the new program was that the newer program was more focused on the clinical science courses, that we had to expose students more in the clinical courses as opposed to the earlier program, which had less clinical courses. The first cohort of this program was 28, and they graduated in the year 2020. And the second cohort of 28 graduated in the year 2021. So the total number of students who have graduated from this optometry and vision science is 132 to date.
Who is qualified to enroll to this program? Direct entry, we have of course a KCSE certificate with a B in English, B in biology, B in physics, and B in mathematics. Those are the requirements for the people who are supposed to join in direct from the form for KCSE, of course in Kenya to this program. But we also have now the program we are rolling out. We are taking our first cohort now to this OD program. And we also expected, because those ones who did BSc or Bachelor of Science in Optometry, a 4-year program, will also want to upgrade. And indeed, even our students who did the BSc for 4 years will want to upgrade now to OD. So they also join in, and they will be given, we have their own structure. They will be exempted from the courses they did in the BSc, and therefore they will just be required to upgrade and to OD, those who wish to. So those ones can also be admitted into the program to start at a particular level, and they have their own structure customized to their need to just fill the gap of where they didn't cover under the BSc. We also have students who are doing a 5-year program right now, but is Bachelor of Optometry. They also missed out on some courses that are now in OD, and therefore they are also allowed to join in at a particular level, and we also have a structure customized to that particular group of people. Also have people who have done a diploma in optometry. They are also allowed to join into the program and upgrade to OD. So currently, as at now, we have got students in all those years from 1st year to 5th year.
The programs in optometry are key programs of this university. I believe that all of us are aware that MUST is a science and technology institution. So optometry is one of our key areas of focus as a university.
As you've moved around, you've seen we are well equipped to run the course with well-trained staff. Yeah, the faculty is well-trained to be able to run the course. We have a staff of about 8 instructors. So we are well equipped to run the course. Apart from the BSc course, we also offer, actually we are the only university offering the MSc course in clinical optometry. Other universities offer MSc in public health optometry. So that is our strength as MUST. And for the BSc program in East Africa, we are the only university offering the Doctor of Optometry in optometry and vision optometry and vision sciences. So it is a good course. We are the pioneers, and currently we are the only university offering this course. It's a good course, and we have collaborations with other institutions, the hospitals and other institutions, even outside, international universities, to be able to offer, quality to our students. Apart from that, we run a lot of community outreach activities. And the purpose of that is to be able to expose, especially our 5th years, to the actual cases in the field.
To us. The department, in addition to the academic, has a vision center. The vision center is where a number of people can visit for eye checkup and then referral if necessary. Our students do their clinical practices in the workshop. The department, being a key department, being one of the focal departments in the university, is a department that has the future. The demand is very high. The facilities are what are putting us slightly in a lower position, otherwise we will take more students. Remember, optometry and vision science being a new area, MUST is the only university in Kenya offering this program. Being the only university offering this program therefore means that we are not able to provide sufficient workforce for this country. Hence, the importance of this department. So the future is bright for the department, that if MUST can develop and enhance this program, then it will be a big changer for this university.
I'm Andrew Ekesa. I'm a lecturer in the Department of Optometry and Vision Science. I'm in charge of community outreach, and my training I have a special interest in pediatric optometry and optics. So being in charge of community outreaches gives me a good opportunity in terms of interacting with the community within the institution, where we offer several eye services to them. we have been able to carry out several community outreaches within, currently, the past 1 year, we have, that is 2021, we have had a screening of over 4,000 students, which are primary school going children, and we have really established that they really need these services in the community. Some of the challenges that we always encounter when we get them into the communities are, for example, the pupils are not aware that they have the conditions. And even the parents are also not aware that their children are also having going through such troubles in terms of reading. And even the community itself, very recently when we went to a place called Chegwai, we realized that some of the local community have also the problem, but it seems that they are not aware that there is a place which they can be helped, for instance, where they can be given some of the referrals. So the university has had its mandate in terms of community engagement, which it is also given a docket and a directorate fully. So the department works with the directorate to make sure that when we go for this outreach, we diagnose, manage those conditions, and those ones that require spectacles, we take the measurements and come and make the glasses in this place section, because this is a workshop that we carry out on the glassing, fitting, and going back to the community to dispense them those glasses. Currently, the community are not paying because we have well-wishers who help us, and the university also chip in terms of giving such services as a way of community social responsibility for the university, and it has done well for the past years. We have several projects in the department that also support our community outreach programs, apart from the university, which give us ample time in terms of resources, in terms of human resource, that is transport costs and some of the lunches for the participant. Then the project will cover in production of the lenses, frames, and even medication that it has had in the previous session. So, being a pediatric expert, in my own view, I have seen that these programs have really helped the community, mostly the school-going children, which have high prevalence in terms of refractive errors. Refractive errors, either short-sighted or long-sighted, and yet they are not being corrected at that level. Apparently, we are lucky to have a cataract surgeon in the team, which will work closely together when you have the surgical components, and it really comes in handy to see the best way where he can refer, or he can even do himself the surgery as per what the level of his training. So for us, we work as a team to make sure that we deliver in terms of community outreach for the university.
There are a lot of challenges when it comes to vision, and that's the reason why optometrists and anybody in the eye care, we work hand in hand with ophthalmologists, ophthalmic clinical officers, and being the fact that I'm an optometrist, it is my primary role as a primary eye care giver. And apart from that, I'm also trained as a trainee in low vision, whereby if all these other cadres have seen patients that have got eye problems, to some level you might find a situation whereby you are only told that this is a diagnosis and it cannot be reversed. Yet it has got advanced loss of vision. So for me, I have passion in actually rehabilitating for those who have lost their vision adversely. We rehabilitate them so that we have other ways of which they can continue their daily activities. And that is actually what I'm doing here at the university. Apart from that, we also encourage other eye care givers or eye care practitioners to enroll for some of our short courses. Now that I'm a qualified trainer of trainees in low vision. Low vision is cutting across, just like any other subspecialty of optometry, just like contact lens, pediatric care, all that. We tend to actually grossly involve all parties together in running this optometry thing. And the uniqueness about optometry in Kenya is that we still need, there's demand for eye care practitioners vis-a-vis the number of population that we need to serve. And this is actually encouraging a lot, more so when it comes to eye care generally. And we really appreciate other partners that are also involved in eye care across the country.
My name is Alfred Ragot. I'm an optometry by profession. My specialization is pediatric optometry and binocular vision. I'm a staff in most department of optometry. I'm the clinical coordinator. Yeah, so I'm the one responsible for the clinic here, the FVC. My profession involves first, as an optometry, I'm the primary eye care provider, which include receiving patients who have ocular conditions as the first line doctor. Yeah, and our role involves doing examinations and management of ocular conditions and those who have visual problems by give of glasses and treatment with medications. Sometimes we also do perform minor surgeries. So the experience has been really good because most of the community screening that we've done is basically on children. We've done screening in schools, and we've got a lot of conditions that that has been very interesting. Yeah. For example, some of the schools we go to, we find children with eye conditions that if we could not have managed at that time, they may have progressed and make it worse, or maybe them going blind.
My name is Winnie Jepkemboy. I'm an optometry student in my 5th year, and I'm very lucky to have been taken in by the institution to practice to train through this career. And one thing I'm proud of in the department is the availability of enough resources, as both the machines and the human resource. It is a motivating profession because one thing is you get satisfaction from the patients. It's almost an immediate satisfaction because if one's vision is improved, you just see the smiles from the patients, so it is really a good profession. I can say I'm confident enough because with these equipments and the training that we've gotten from the institution, I can say I'm good to practice outside there. Interaction of the equipment starts all the way from when you join, that is first year. You get introduced to know the equipments. When you are in second year, you learn how the equipments work and you get a chance to also use them. When you're in third year, you get to know how to make these spectacles, lenses, measurements, give a good prescription and give the frames and fitting of the lens. Yeah, so I can say the interaction with the machines is good. You get enough time, the machines are adequate, everyone gets a chance to use them. I would say it is a good course. One thing is we just don't stay in school, we just don't do theory and learn using our machines. Our lecturers or the institution also organize outreaches. We move to the community, we get to see conditions that are out there that we cannot see them here in school. So with this, I can say we get good experience, and you cannot go outside there and fail to produce well. So I will ask anyone who is really interested in joining a health course, this is one that is very interesting.
I'm Mariam Said from Marsabit County, third year optometry student. I'm in third year, second year right now, taking optometry as a course and inshallah as a profession in future. I can say first year was one of the toughest years in optometry because you've chosen the course but you don't have enough knowledge about the course. So you have to come to school to learn more about the course first. So first year was one of the toughest year. From first year, so you take up yourself, learn the course, optometry, you start seeing optometry as one of the enjoyable course. Yeah, I can say the beside first year being tough, it's good. The experience is good. The school is well equipped with the optometry resources, and we are getting enough training for the course.